All right, let's go ahead and get started, everyone. Hey, welcome to the May Health Innovation Community Partnership meeting. My name is Heather Hayes. I'm the Associate Director at the LAC, at the Los Angeles General Medical Center Foundation and the Wellness Center. We're so excited you're able to join us here today for a rich conversation about the issues and projects that are happening on and around this incredible medical center campus and in the surrounding communities. So I think everyone can see my screen okay, so we'll go ahead and continue forward. Just as a reminder, you can tell we're all via Zoom today, but this meeting is being recorded, and the recording and the materials presented here today will be posted to our website in about a week's time. That website is hicpla.org. We do always want our meetings together and our time together to be really interactive. This is an opportunity for respectful dialogue and conversation about the issues we all care about that are impacting our campus and community. So here's a few tech notes for your Zoom meetings. Please mute yourself unless you're speaking. You can turn your audio and video on or off by clicking the microphone or camera at the bottom of your toolbar. And we invite you to raise your hand or put comments in the chat at appropriate moments so we can be sure to get to all of your questions and all of your comments throughout the meeting. This meeting is being interpreted in Spanish, so if you are interested in participating we ask everyone, in fact, to please select the globe to indicate the language of your choice in the menu bar. That will ensure that you're involved in the conversation, whether it be English or Spanish, as we go back and forth across those two languages. So please, everyone, choose the interpretation globe and pick the language of your choice. All right, and with that, we'll go ahead and jump right in. Let's take a look at our agenda for the day. As always, we're excited to welcome the Los Angeles General Medical Center to give us an update about happenings on the campus. It has been a very active week, and we're excited. The month of May has a lot of wonderful things coming on the campus as well. Then we're going to have a community health update presented by the Department of Public Health related to measles in the community. And then we're going to spend the majority of our time today talking about immigration enforcement. We have some wonderful experts joining us from multiple agencies to share perspectives on that topic. Then we will have our regular campus projects update, what's going on the campus across the many restorative care village and Centennial projects that are hosted here, and we'll end with some partner announcements. So that is our agenda for the day. So if you have those announcements that you want to share out with this group, please get those ready. We'll invite you to do so at the end of our meeting. Okay. Before we begin, I'll go ahead and read the guiding principles aloud from the Health Innovation Community Partnership's vision and mission document. Boy, that seems like a tongue twister this early in the morning without enough coffee. Okay, all participants agreed to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. All participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, I am delighted as always to turn the podium and the microphone over to Jorge Orozco, the CEO of the Los Angeles General Medical Center. Welcome, Jorge.
Hi, Heather. Welcome. Good morning, everyone. I am really happy to be here to provide some updates on LA General and what's going on. As many of you are aware, we experienced a 2-day labor strike this week that temporarily impacted operations and services across our medical system. including trauma services here at LA General. Throughout the strike, patient health and wellness really was and continued to be the top priority that we had. And our medical centers, emergency rooms, urgent care centers, and inpatient services remained open to the public throughout the strike. We also acknowledge that it did have some impact on some services such as trauma, STEMI, and other critical services. We made arrangements to have ambulances diverted from LA General because of our staffing levels. And this was deliberate, and it was part of our proactive planning here. In the 10 days leading up to the strike, we worked with the EMS agency to coordinate ambulance diversions. And this coordinated response is exactly how our emergency system is supposed to work, ensuring that patients receive timely care, even under challenging conditions. Having said that, we recognize the very real impact that this had on our patients and communities. And anytime our emergency departments are affected, our services are reduced, our community feels the impact. And there was some media coverage of some individuals who had to be transported longer distances because of that. And we really take that responsibility seriously. Throughout the strike, we had a command center, we monitored conditions, we made adjustments. Patients who were scheduled with appointments were contacted directly and offered telehealth visits or rescheduled when appropriate. And those who really needed to be seen were brought in during this time and were seen. So we want to thank our patients and the broader community for their trust in us and understanding during this trying week. And we also want to extend deep appreciation for the thousands of DHS staff. Over 60% of SEIU 721 represented clinical and support staff showed up to help provide care for our patients. And we really, really appreciate that dedication to the care that we're delivering. So thank you. I'd be happy to answer any questions that anyone might have.
Do we have any questions or comments for Jorge before we move on in the presentation? Okay.
All right.
That's the case. We'll go ahead and I'll continue the presentation, Jorge.
Great. Thank you. I want to introduce Dr. Chase Coffey, our Associate Medical Director, to really share some exciting news and updates on LA General. Chase.
Thanks, Jorge. Good morning. Buenos dias a todos. And lo siento, that's about as much Spanish as I speak. But I'm happy to be back. And you guys have heard about three-peats in the for championships like the Dodgers and like the Lakers. I'm here to share with immense pride that this hospital has earned a three-peat of a safety grade from the Leapfrog organization. One of the first times I came to HICP was to share our first Leapfrog grade A, and that was 18 months ago. And as a reminder, Leapfrog is a private institution that grades hospitals on the safety of care that they deliver to patients. And it's a nationwide organization, and all kinds of hospitals are included, from the Kaisers to the University of California systems, to Cedars-Sinai and Torrance Memorial, to White Memorial. Everybody is involved here. And this organization has earned its third consecutive grade A for our safety work. And if you're familiar with restaurant safety grades, this is akin to that type of example. And we're extremely proud of this work. It has taken several years for us as a group, as a team, to get to this mountaintop. And we are very proud that we continue to deliver safe and high quality care for our patients. We know also that our work isn't done and that getting better never stops. And this organization is committed to continuing our work to provide safe, effective, equitable, and sustainable care for all of the patients in our community and all of those who cross our doors and come and seek care from us. I could go on and on about how we got here, but I know my time is limited, and I'm happy to answer any questions that the community may have.
Thank you so much, Dr. Coffey. Does anyone have questions or comments for Chase about this incredible accomplishment of the LA General Medical Center? It's really transformative to be receiving these accolades, including the Leapfrog score. And then I know we discussed at the last meeting the magnet opportunity that is coming to our nursing program. So really just such an exciting time for the leadership and the team at the hospital to have achieved so much of these incredible, accolades and goals for the quality of care. Do we have any comments or questions? And for our community, that's right, Chase. All right, I think it's a little bit of a gray Friday morning, and maybe it's a little early for a lot of us. I feel like the dialogue hasn't quite started rolling yet, but thank you, Jorge, thank you, Chase, so much for joining us this morning and sharing out a bit of these exciting happenings in the campus. Does anyone have? Well, we still have Dr. Coffey with us, and Jorge too, of course. Does anyone have any comments about other things that might be happening on the medical center campus that you may have heard about, that you have questions about? All right, I guess not. Well, thank you so much again for joining us. Go have a wonderful Friday, and I hope you both enjoy a very restful weekend. You deserve it.
Thanks, Heather.
Okay, so moving on in our presentation, we're excited to have joining us today a member of the Los Angeles Department of Public Health. Alonso Machuca is joining us to talk a little bit about measles. We know that there's been quite a lot of information about measles hitting the population of our community, and so we invited the Department of Public Health to come and join us today to share a bit about what that means. So welcome, Alonso. We're so excited to have you with us here for, I think, your first time, your debut experience at the Health Innovation Community Partnership meeting.
Wonderful. Good morning, everybody. Let me know whenever you're ready.
Okay, yeah, just let me get my visuals all settled and then we'll kick it off. Okay, full screen mode. We'll go ahead and put a spotlight on you. All right, Alonso, welcome. Thank you so much for joining us at the Health Innovation Community Partnership. We're excited to have you join us, I think, for the first time. It's lovely to have you with us today.
Thank you. Thank you. You are absolutely correct. This is my first time joining your meeting. Thank you so much, Heather, for reaching out to ask us to present on measles during this very difficult time with something that is preventable with a vaccine. So, Heather, I can't see the screen. If you wouldn't mind helping me, if anyone has any questions, by all means, feel free to chime in. Or let me know if someone has any questions. There's not too many of us here, so 60. So if anyone has any questions during the presentation, by all means, feel free to ask. And with that, let's get started. So everyone, good morning. My name is Alonso Machuca, and I'm a public health nurse with LA County Department of Public Health. And I've been invited here to share some information that I hope you find helpful, so that you may be able to inform your families, your clients, of what's going on and the steps that they can do to protect themselves. And hopefully some of the information that you will hear today will address maybe certain misinformation or some misleading information that I personally am seeing on some social media sites. So with that, Heather, if you would kindly move to the next slide. So what are the objectives today? We're going to talk about and describe measles. I'm going to also provide some of the latest numbers, both nationally, both in California and here in the county. Who is really at risk? And what can we do to prevent measles? Next slide, please. And one more. Now, measles is caused by a virus. So we know that viral infections cannot be treated with antibiotics the way that we would treat bacterial infections. One of the things with measles, it spreads extremely, extremely easily. One person can actually infect 9 others. And it's completely preventable with a vaccine. The vaccine known as MMR or measles, mumps, rubella, it's a combination of 3 vaccines in one. Next slide, please. So again, measles, very serious disease that can cause the following problems: ear infections, diarrhea, to much more severe problems such as pneumonia, encephalitis, which is swelling around the brain. Now, about 3 out of 10 people who get measles will develop one or more complications, including pneumonia or encephalitis. Now, not sure if everyone has heard of the term immune amnesia. We know that this is caused by measles infection, and that is really a phenomenon where measles infection causes the immune system to really forget any previously acquired immunity, making individuals vulnerable to other infections that they had previously developed antibodies or protection. So, for example, if you had a certain infection 5-10 years ago, you have these memory cells in your body. If you should come in contact with that particular germ again, your body will remember, hey, I remember, let me start sending these antibodies. But with immune amnesia, it's if you should be exposed to that, it's like you would be acquiring it for the very first time. Next slide, please. Now, one of the things about measles, it spreads extremely, extremely easily. It's an upper respiratory virus, which lives in your nose and your throat. It can be spread through the air, through aerosolized air droplets, or also on surfaces. Anytime a person coughs, sneezes, talks, right? And it can stay in the air for about 2 hours. So ventilation is really, really important. When I used to work in a clinical setting and we had someone with a measles infection that would come in, we would automatically, mask the person, put them in a room. Once they were done, we would then enclose that room for 2 hours, put a sign, no one enter. After those 2 hours, I would go in and disinfect all the surfaces. So again, viral infections cannot be treated with any antibiotics. Now, sometimes individuals will be prescribed antibiotics for a secondary infection or a bacterial infection. When your body is fighting a virus, there's this misbelief that, the doctor can just prescribe me an antibiotic. Sometimes they will, because there's a secondary bacterial infection. But that antibiotic in itself will not do anything for the viral infection or the primary infection. Okay, next slide, please. Now, what are the symptoms of measles? Most commonly, high fever, cough, runny nose, watery eyes. But what's very distinctive, being a former pediatric nurse, is a rash that starts in the face and usually on the top of the face, and it spreads to the body. Now, it's really, really important that the incubation period, that's the time that it would take for someone who was exposed to develop symptoms. Now, from the point of infection, it's anywhere from 7 to 21 days. But on average, you're looking at about 10 to 12 days. That's the incubation, or that's the time that someone will develop symptoms. Now, one of the questions that I get quite a bit is, when is the person infectious? When are they no longer infectious? So when we're looking at measles, here at the health department, we look at 4 days before the rash, the onset of the rash, and 4 days after the onset of the rash. So that's really, really important when we are conducting a contact investigation, when we have someone suspected of having measles. We are really looking at that time frame. And we know that about 20%, or 1 in 5, who develop those serious complications that I mentioned earlier, such as pneumonia and encephalitis, will be hospitalized. Next slide, please. Now, what should you do if you have measles? You were a contact with someone with measles. You're concerned that you might have measles. First, we don't want you to go to your doctor's office. We don't want you to walk into the emergency room. What we would like for you to do is first call your doctor's office or call the emergency room that you are thinking of going to. It's important that you get medical care. I'm not saying not to get medical care, but we want to prevent the spread to others, again, because it can spread so easily. Call your doctor, let them know. If you're not able to get in touch with your doctor and you need to go to the emergency room or an urgent care, a lot of people are visiting urgent cares. You want to call them ahead of time to give them time to prepare for your arrival. Most likely, they're going to bring you some of the sites, some of the facilities where I've worked is we have a different entrance where we would bring people through. Because we apologies for that. We don't want others to be exposed, anyone from the front desk to anyone that's waiting in the waiting room to anyone in the back. So we want to be prepared. Let them know, because again, this prevents the spread of measles, and they can prepare for your arrival. Next slide, please. Now, who is most likely to have a serious health problems? So that would be people with a weakened immune system, like leukemia or HIV. Now, it doesn't mean that individuals who have never been vaccinated or were previously exposed to measles who might have HIV or leukemia cannot receive the vaccine. But there are certain markers that we need to ensure. So remember that the MMR vaccine is a live attenuated vaccine or a weakened virus. And we don't want individuals with a very depleted or weakened immune system to actually develop the disease from the vaccine. So we want to ensure that individuals, for example, with HIV, their CD4 count has been stable, it's way above 200, or individuals with leukemia, we want to make sure that they're not currently undergoing treatment. They're not on some kind of immunotherapy. So there's a lot of things that we need to consider. Kids younger than 5. Why? Because typically kids younger than 5 have not had the opportunity to be fully vaccinated. And I'm going to talk a little bit about the schedule in a couple slides. And pregnant women. Why? Our biggest concern, it's a live virus. And in theory, we don't want to possibly infect the fetus. So these are questions that really need to be explored extremely careful with your provider to ensure that you're going to be safe. And also, individuals who are immune compromised may not develop that robust response to the vaccine because their immune system is just not there at that time. Next slide, please. Now, there is no cure for measles, okay? There are no antivirals for measles. The treatment really focuses, it's palliative treatment, relieving the symptoms. You know, if there's a fever, if there's dehydration, if there's diarrhea, we're going to manage those symptoms, right? Now, there's been quite a bit of chat, I would say chat, on the news about vitamin A. And I really want to take this opportunity to really address maybe some of the confusion that we've been hearing out there, or at least that I've been hearing. Now, vitamin A is a supplement, and it's used as a complementary, now let's listen, complementary therapy for measles. But it's not a substitute for vaccination. And what vitamin A does is it doesn't prevent measles, but it can help prevent the illness from becoming more severe and may reduce mortality, especially in those areas where vitamin A deficiency is common. But vitamin A supplementation must be provided under a physician's supervision. Now, what's going on with vitamin A in measles? We know that vitamin A, the levels drop with measles. And one of our concerns with vitamin A deficiency is it can damage your eyes, well, blindness, right? Now, again, it helps to reduce the severity and decrease the mortality, specifically in children with vitamin A deficiency. We usually see that in kids in developing countries where nutrition, sometimes it's very questionable or it's not consistent. Again, vitamin A is a complementary therapy used in part under the supervision of a physician for the management of measles and other supportive measures. So I hope I've been able to shed a little bit of light with vitamin A and measles. Next slide, please. And one more. So these are the current numbers. These are the numbers as of April the 30th. So that's our population that you see on the screen. Currently in the US, we have, as of April the 30th, this is a very dynamic situation. Measles is spread extremely, extremely easily. So currently we have 884 confirmed measles infections in the US with 3 deaths reported, unfortunately. In 2024, there were 285 and no deaths. Now, what's really important to take from these numbers, sometimes when we talk about numbers, I want those numbers to really have an impact. Now, out of these 884 confirmed measles infections in 2025, 97% of those individuals were not vaccinated, are not vaccinated, or their vaccination status is unknown. 97%. That's terrible. And currently, out of these 884 individuals, 11% roughly, or 94 individuals have been hospitalized. Now, in 2024, like you see on the screen, 285 cases, and out of those 285 cases, 89% of those individuals were not vaccinated, or their vaccination status is unknown. And 40% of those, 285, were hospitalized for isolation or management of those complications. And if you want to hear more of the age breakdown, I have those, but let's move on to the next slide if anyone has any questions. Now, in LA County, oh, I'm so sorry, Heather, can we go back to that slide? Thank you. Now, while in LA County currently, there's only been one case of measles, and that is as of April the 30th. So the number of cases nationwide is high. Luckily, the number of people who get measles in LA County every year is very small because we have a relatively high vaccination rate. And that number has been fluctuating somewhere between 96 and 98%. But there are pockets in our county where the vaccination rate is lower. So that increases the chance of people getting and spreading measles in the county. Thank you, Heather. Let's move on to the next slide. All righty. So again, why are we seeing more measles? Most people in the US are protected against measles through vaccination, but we've seen more cases than usual because of unvaccinated travelers have brought the virus from other countries. And I can share with you that the individual in LA County had traveled not outside the country, but had traveled to Texas, which sort of is the epicenter of the outbreak. But fortunately, when the traveler was traveling back to California, LA County, they traveled during that period. Remember how I said you're infectious 4 days before the rash, 4 days after the onset of the rash? Fortunately, that individual traveled when that person was not infectious. So that's a good thing. Okay, next slide, please. And again, here you go. As of April the 30th, in California, there's been 10 cases confirmed. And if we look at 2024, we have 15 cases with 4 cases in 2023, and that one case as of the 30th of April in LA County resident. And as I mentioned, fortunately, that traveler was not infectious during that infectious period. And individuals who have not had measles in the past and have not yet obtained the measles vaccine are at risk for developing measles. Remember that 7 to 21 day period, which is where you can develop. Now, if you were exposed to someone or you think you were exposed to someone with measles and you isolate at home for 21 days, after that 21-day period, you're no longer at risk for developing measles. Okay, next slide, please. Here you go. Sometimes when I'm out working in with the community or doing presentations, this is a really great analogy that I like to share with community members who may not particularly understand herd immunity or why should we maintain our vaccination till about 98%. Now, remember that not everyone can receive the vaccine, or not everyone can develop those antibodies if they receive the vaccine, such as those individuals who are immunocompromised, pregnant women, individuals who might have low platelet counts, individuals who might have had their spleen removed, things like that. So this is what I like to share with them. Imagine that each brick of this fort represents a person that gets vaccinated. So the more bricks we have, the stronger the fort is, and the better it protects what's inside the fort. Let's also imagine that what's inside the fort are the groups of people that can't get vaccinated for medical reasons. That includes newborns, people with a weak immune system, so forth and so on. So the more people we have that get vaccinated, the stronger level of protection we provide to those that cannot be immunized. So the fewer bricks we have, that is, the fewer people get vaccinated, the greater the chance that those unvaccinated people can get and spread the disease. Next slide, please. Now, again, we already talked about who is most likely to get sick from measles, right? It's a risk for any person that has never either had measles or received an MMR, the measles, mumps, rubella, which is a combination of 3 vaccines in one. And remember that 9 out of 10 people will get sick if they come in contact with the disease. Next slide, please. Again, who may not be able to get vaccinated? As we were saying, individuals with immunocompromised, individuals with low platelets, or anyone. We need to wait 4 weeks to receive a live attenuated vaccine if they received any prior vaccine. So we have to give them a month. It's contraindicated if someone has an allergic reaction or is allergic to neomycin. Now, pregnant women, like we were saying, that theoretically we don't want to potentially infect the fetus. So that is something that has to really be discussed with their OBGYN. And I think that's it. Next slide, please. And one more. Now, the MMR vaccine is 2 doses. So typically, after you receive 1 dose, you want to wait about 2 weeks to about a month. 1 dose provides 93% effectiveness in preventing measles. The second dose is 97% effective in preventing measles. Next slide, please. So this is the typical vaccination recommendation. So for kids, we want to vaccinate them somewhere between the 12th and the 15th month for their first. And their second one is typically between 4 to 6 years. Most of the kids, as I said, as a previous pediatric nurse, typically most kids get it around age 5. But it can be 4 to 6. Now, any teens or adults that were born after 1956 who have not been sick with measles, anyone that has not been vaccinated or who has not had those 2 doses needs to be vaccinated. Next slide, please. Now, these are the recommendations during an outbreak, which we're currently seeing. If you are younger than 1, you can receive an early dose, 6 months of age or older, but you'll still have to receive your second at 12 months and your third around age 4 to 5. So that means 3 instead of 2. Now, remember, these are recommendations during an outbreak. Now, anyone that's 12 months or older who have received 1, they can receive their second one. Now, this is during an outbreak. They can receive their second one 28 days after the first MMR vaccine and no additional doses. So that would only be a total of 2. And then, turn this off here. And then adults who have received their first MMR may receive their second one, again, 28 days apart. And then no additional doses. And then, like the previous slide, please consider if you're someone that was born before 1957, you have no proof, you're not sure of getting that MMR vaccine. Next slide, please.
So Alonso, if you were born after 1957 but aren't sure if you were vaccinated, what's the recommendation for that population?
Get vaccinated. If the person was born after 1957, but they are not sure if they ever had measles or have been vaccinated, I would really, really recommend making an appointment with your primary care doctor, having this conversation, and getting vaccinated. Now, remember that these are the recommendations during an outbreak. One of our concerns over at Public Health, summer is coming. A lot of people travel. So if you're going to be doing some traveling, especially to Asia, certain places in Europe, certain places here in the States, you want to make sure that you are protected against measles. Sometimes we have family visiting during summertime from other states where their measles cases are high. You might want to make sure that those family members are vaccinated, especially if you live with someone who is immunocompromised, an elderly person, um, to make sure that everyone is safe.
Yes, and you mentioned, that we wouldn't give the vaccine to a pregnant woman. Are there potential difficult consequences for the fetus if the mother contracted measles?
Yes. So one of the things that we want to make sure, because this is a live attenuated vaccine, meaning it's a live weakened virus that we will introduce to the person so they can develop these antibodies. Now, it is believed that if we can potentially infect the fetus with measles, so this would be a conversation with their OBGYN to see what are the possibilities, what is the option for that individual.
So my question wasn't about the vaccine per se. It was saying what happens to a pregnant woman who gets measles, not about getting vaccinated.
Oh,
Like I just think are there negative consequences to the fetus of the mother contracting measles while she's pregnant?
yes. Very serious complications could be the fetus can potentially die, mom can potentially die. So very serious complications. This is something that we also do when we have a female individual coming in to be vaccinated. We want to ensure we do a pregnancy test just to make sure. This is something that we also, if someone is thinking of starting a family, this is one of those very important conversations to have with your OBGYN or your primary care doctor.
Yeah. Yeah, I was really commenting on or reflecting, I should say, on the fact like you see this incredible jump in the numbers of infected people in America from this year over last year, but when you look across California and LA County, it's really not any higher. So it really is these blooming spots in other states that I imagine. So when you mention that whole like visiting family and seeing family, it's like you may feel pretty safe here in Los Angeles because there's not a lot of reporting and not a lot of incidents, but that doesn't mean that loved ones of yours might not be exposed in other places in America.
Absolutely. And one of the things that I'm hoping with the information that you guys received today is if you do have family member, friends, loved ones, and maybe some of these states where the cases of measles is incrementally increasing, is to let them know, um, encourage them to be vaccinated so they can remain safe. Do you remember, I think it was back in 2014, 2015, there was a measles outbreak stemming at Disneyland.
Yeah.
There were about 100 and I think 13 individuals with measles, and they were individuals that traveled to Disneyland. So one of our concerns is we have a lot of amusement parks here in California. There's a lot of sightseeing, especially with school being let out, I think next month. It's really important that you're protected, your loved ones are protected, and the best way to be protected or decrease the severity is to be vaccinated.
Thank you.
Oh, you're very welcome. Next slide, please. So again, if someone is not vaccinated, 9 out of 10 people will get sick. Those that receive 1 dose, you're looking about 2 out of 10. And those that receive 2 doses, 1 out of 10 will get sick. So we are really recommending getting vaccinated. Now, is the MMR vaccine, the vaccine, I'm sorry, here. Is it safe? Yes, most kids don't have any problems, but, and that is correct, 1 out of 100. I apologize for that. Most kids and adults don't have any problems. The most common Side effect that's reported could be maybe a low-grade fever, soreness, warmth at the site of the infection. But that resolves with some over-the-counter Tylenol, ibuprofen, but mostly everyone tolerates them very, very well. Next slide, please. Now, this has really been something in the news. Some individuals, have been saying that MMR vaccine, worry that the vaccine may cause autism, since signs of autism show up around the same time when kids get the MMR. So there is no proof, and we're going on 27 years, right? 27 years and still combating this false information. There's no proof that the measles vaccine or the MMR or other vaccines cause autism. In 1998, a physician by the name of Andrew Wakefield wrote a research paper in a medical publication of the Lancet. In this paper, Dr. Wakefield claimed that there was a link between vaccines and autism. By 2010, the Lancet found no proof of this claim. What they did find was that Dr. Wakefield was paid more than $665,000 by attorneys who wanted to show that the MMR vaccine was unsafe. Also, there is no proof that thimerosal, which is a preservative, leads to autism. But to address this concerns, thimerosal was completely removed or reduced to extremely low levels in all childhood vaccines except for one type of flu vaccine in 2001. Not all inactivated flu vaccines contain thimerosal. So we're still kind of trying to fight this belief that autism is caused by vaccines 27 years later. Next slide, please. And what do we do to help prevent people from getting or spreading vaccines? Our vaccine preventable program reaches out to physicians. They visit federally qualified healthcare centers to continuously provide information. We report cases to the California Department of Public Health so they can see the impact measles is having here in the state. We investigate all measles cases and we identify people who are exposed to someone who sick with measles or those close contacts. Next slide, please. And what do we do when we find out that a person had contact with someone with measles, right? So first, the contact will be tested for measles immunity. We want to see if they were vaccinated before. We can offer the MMR vaccine within 3 days. If they have no proof or they're not sure if they were vaccinated, and we want to ask them to limit their participation in activities with large groups. Remember that 7 to 21 days, right? And we will determine their level of contact. Where were you? How much time did you spend with the individual? Those things. Now, the MMR vaccine can be given after exposure to measles, but it's not effective if it's administered, but it's most effective if it's administered within 72 hours of the initial exposure. They may offer someone immunoglobulin within 6 days of exposure to prevent or lessen the severity of measles, but that requires a certain protocol that has to be discussed with a provider and with public health. Next slide, please. Now, where can you get vaccinated? Your primary care doctor. Most commercial insurances are contracted with pharmacies, CVS, Walgreens, Walmart. I think Walmart provides vaccines. You can also call Public Health Info Line at the number that's noted on the screen to find out where they can get vaccinated. Our public health centers also offer vaccines. I know that we do offer the MMR vaccine as well. And you can get that information by calling that number on the screen. Next slide, please. Now, here on the screen, this is more more resources where you can get more information about vaccines, our Centers for Disease Control, and the California Department of Public Health. And next slide. And this is where, again, where you can get to, this is where you can go to get more information if you'd like. And there you go. Does anybody, yeah, there you go. Does anybody have any questions?
Do you have any questions for Alonso? I have one last question for you, Alonso. Ooh.
Can you hear me, Heather? This is Carla Gonzalez.
Yeah, we sure can, Carla. Go for it.
Hi. Thank you, Heather. Hi, Alonso. I just wanted to thank you so much for this presentation. So much valuable information in keeping our communities safe. And, you know, I just wanted to let everybody know that if there's questions, any sort of questions, there's no silly questions, there's no dumb questions when it comes to your health and the health of our community. So we are here and we're open to discuss further any things that you may need to clarify. I know one of the things, Heather, you asked about was you know, the harm to a mom, a pregnant woman, and I know we worry about like low birth weight and miscarriage. Those are some of the things that we worry about, and then some of the things that when we ask for people to call us before, it's really so that we can be ready and prepared, make sure that we have the rooms available to best take care, you know, rooms that are appropriate for receiving patients that have been exposed to infectious diseases. Sometimes we like to use the special rooms with extra protections that are closer to the doors so that we can get the person in right away and, you know, have the least exposure. So that's really why we ask to have people call us before so we can get ready and be ready to receive. So thank you so much, Alonso. This was phenomenal.
Thank you.
Really, really deep presentation, like thoughtfully made out and paced. Really appreciate that. And excellent point, Carla, to let your providers know in advance if you have that suspicion of measles. You don't just walk in the door, you call in advance so that these special protocols can be put into place. Excellent point. I know Alonso made it. Thank you for reiterating it, Carla. All right. So my last question for you, Alonso, was just how many people might be asymptomatic that get measles? Do we have a sense of that?
You know, I don't have that specific number. I know that we do have that 7 to 21 day period. I don't have that number, but let me reach out to our acute communicable disease program, Heather. And I think that's an excellent question. And I will email you I'll email you what they share with me.
Perfect. Thank you so much. And just as a reminder to everyone, we will, of course, be sharing these materials out with everyone, and they'll be posted on our website as well. All right, Alonso, thank you so much for joining us today. Hopefully the first of future opportunities for you to join us. We look forward to that.
Thank you. Thank you, everyone, for your time.
Great. Well, we'll move on in our agenda now. Our next presentations, we have a series of presentations. We're very excited to welcome so many amazing colleagues from Public Counsel, from CARECEN, and from the Office of Immigrant Affairs to talk with us about immigration enforcement in the community. We know that that's an ongoing conversation and topic of concern, so we're delighted to be able to bring these wonderful voices together today to kind of share their perspectives and thoughts. With that, I'll go ahead and stop sharing. So that if you guys have a presentation, you can take it away. But let me kick it off by introducing Gina and Jana from Public Counsel, who will be doing our first presentation on immigration enforcement today.
Hi, Heather and group. Thank you so much for having us. I assume you can hear me okay, right? Heather, can you give me?
Yeah.
Perfect. My name is Gina Amato, and I direct the Immigrants' Rights Project at Public Counsel. And I'll pass it to my colleague, Jana, to introduce herself.
Hi, all. Good morning. My name is Jana Whalley, pronouns she, her, and I'm a supervising attorney with Public Counsel's anti-detention team. Good to be here.
Yeah, so Public Counsel, for those of you who aren't familiar, is a nonprofit law firm in Koreatown. We have been, hey Cassidy, we have been in business for about 55 years. What we do mainly is provide direct legal services to underserved immigrant communities. The immigrant communities that we focus on serving are unaccompanied children, so children who entered the country alone, those who are in the immigrant detention system and at risk of removal from the United States, individuals seeking asylum in the US because they've either been persecuted or fear being persecuted in their home country, and immigrants who have been victims of serious crime and human trafficking. So that's really the bread and butter of our work. But in addition to providing direct legal services to those communities, we engage in policy advocacy and strategic litigation to protect the rights of those specific immigrant communities or populations. So light work. It's a really intense time. The first question I saw on the agenda, and just a note that we did not prepare a PowerPoint today. We were more going to go over these questions that were raised and just make ourselves available to answer your questions. So what is the reality today? Well, we are seeing just an outright assault on the rule of law. I mean, I think that's really the most accurate way that I can put it. Whereas in the first Trump administration, we saw attacks on immigrants and the families of immigrants. Obviously, we're continuing to see that. But what's changed is we are really just seeing an outright assault on the entire infrastructure that supports immigrants. So the funding that funds their legal services, the whole infrastructure that supports them and serves them and makes sure that they're okay in the United States. We are seeing an absolute onslaught of executive orders and directives aimed at the immigrant community. 2 days into the Trump administration, there were already 34 executive orders and directives against the immigrant community. So it's really an intense and relentless attack that we're experiencing right now. So the stated objective, there's kind of two stated objectives by the Trump administration. One is to create shock and awe, which they absolutely are doing because they're just relentless in their attacks, and also to target, detain, and deport so-called criminals. And that's definitely not what we're seeing. We're seeing attacks on really the lowest lying fruit. So, immigrant children and really the most vulnerable populations there are. So these unaccompanied children who are here without parents, who were being served by nonprofit organizations, we are seeing the Trump administration target them specifically, first by terminating the funding that provides legal services to 26,000 immigrant children, and also by just a stated policy to actually target them, to detain them, and to deport them. We're also seeing this with TPS holders, temporary protected status, which are usually people who have been impacted by natural disasters and other conditions in their home country. And we're seeing a rollback of those protections as well. Okay, moving on, unless Jana, you had something to add to that question. No. Okay, great. So moving on, what is the response from public agencies and private institutions? Well, in the same way that the Trump administration has ramped up its attacks and its efforts, we have as well. We learned a lot from the first administration. And I think this time around, we're seeing a lot more coordinated efforts, and nationally organized coordinated efforts to resist Project 2025 and all that comes with it. And so really it's focused, I think, on three different buckets. One is Know Your Rights campaigns. We're seeing that across the board with public and private institutions out there, just really doing our best to arm people with the information that they need to protect themselves if they do come into contact with ICE. Jana and I actually provided a Know Your Rights just last night to a group of promotoras who are kind of like public health advocates, I guess, who are traveling to Sacramento next week. And so just really helping educate folks on what their rights are and what they can do to protect themselves when they're out in public spaces. We are engaging in policy advocacy. And when I say we, I mean us and our partners and just the general advocacy community is doing a lot of work to increase funding for legal services, both at the local and state level. So trying to get universal representation programs bolstered and funded, so that we can continue representing people, especially those who are in detention or at risk of removal. And then finally, engaging in strategic litigation to challenge the executive orders and to protect our residents. And so right now, just so you're aware, Public Counsel is seeking to intervene in a lawsuit that San Francisco and 15 other localities filed against the Trump administration, because the Trump administration is threatening to withhold federal funds and increase enforcement in sanctuary cities. LA is a sanctuary city and it's not part of that lawsuit. So while the judge has entered a preliminary injunction preventing the Trump administration from taking those actions, LA is not currently protected. So we are intervening on behalf of 3 of our community partners to try to get LA into this lawsuit so that the protections extend to us. So there's a lot of litigation happening, even with organizations, I would say, that don't traditionally engage in impact litigation. There's also litigation around the termination of the funding that supports immigrant children, and that litigation is going well as well. So at this point, I'm going to pass it over to Jana. She leads, again, our anti-detention team and really works closely with individuals who are detained and sometimes, unfortunately, deported. So she can talk to us about what they're seeing and so on. Jana?
Thanks, Gina. Yeah, so there's a question on here about what's happening to folks who are deported. I also want to spend a moment on detention. So what we're seeing, my team represents people who are in detention here in California, and then also in removal proceedings, just not in detention, but fighting from their homes here in LA. So in detention, we're seeing the detention facilities are getting filled up. ICE is putting a lot more people in detention. As Gina mentioned, kind of there's this much wider dragnet of who's being targeted. They've taken away enforcement priorities. So one thing that's of concern to our clients is if they have a routine scheduled ICE check-in, for example, whereas before we would not have been concerned hardly at all that they could be detained. Now it's like for every single client, we're accompanying them, we're concerned, like, could ICE just detain them? Because they're really targeting a lot of people. Sometimes it feels random, but it's also just like a really wide net of who they're targeting. For folks in detention, one really scary development, I think, is that federal funds are being cut to a lot of immigration services. So usually people in detention have access to something called the Legal Orientation Program, which at our closest detention facility in Adelanto is provided by Esperanza, another partner organization. So now folks getting into detention don't even have that orientation or support with preparing their applications. So we're just seeing like a huge need, folks reaching out, concerned about people in detention having even less support than they did before. And there's always been like attorney access issues. And for folks who don't have an attorney, it's even more grave if you're in detention. You're supposed to present your case without access to much at all. And then, yeah, for folks who are deported, I think we've heard, and probably many of you have heard in the news, people are getting sent to, like they were sent to Guantanamo for a bit, and now we're seeing folks sent to CICOT, the mega prison in El Salvador. So that's not normal. That's new. We've also seen people like taken while they're in removal proceedings. So that means they're in front of a judge. They're supposed to have their day in court, but they're taken like while those proceedings are in place. And then, yeah, for people who are deported, the concern is, they're going back to whatever conditions they fled. Also, a lot of our clients have been here, like maybe since they were kids, for many, many years. They're being separated from their family. And then oftentimes, especially you've probably heard about collateral arrest. That's like when ICE shows up maybe to pick up one person, may or may not have a valid warrant for that person, but then they just grab other people. So yeah, there may not be time to gather belongings or say goodbye to their family. So yeah, a lot of heartbreaking things that we're seeing. In terms of due process means having your day in court. Even people who weren't born here have protections under our Constitution. So they have a right to due process under our Constitution. So yeah, like as I mentioned, if you're taken out of your removal proceedings, you're not getting due process. You're not having a chance for an immigration judge to hear your case and determine whether, yeah, you do merit protection or you do merit some discretionary relief to stay here. Yeah, and it also means availing yourself of the full protection of the law that is guaranteed to you in the Constitution and our other laws. And then one thing that we've been thinking about a lot about, and the community is thinking a lot about, is how can families prepare if they do encounter ICE and are detained or deported. So we recommend like creating an emergency plan, which is, you know, easier said than done, but we do encourage families to take time to think through, like, if a parent were picked up, like who would take their child? Do they have all their important documents in one place that could be accessed? Designating a caregiver for their children, and then memorizing phone numbers if they, you know, ICE takes them, having the phone number of an attorney or a loved one memorized. So those are some points on how families can prepare. And I'll pass it back to you, Gina. I have to hop off, so sorry I can't stay on for questions, but thank you.
Thanks, Jana. Yeah, so actually she got through the end of the material that we were going to present. I don't know if you want to open up to questions now, Heather, or if you wanted to go to the other service providers and then do questions at the end.
Yes, good morning, Gina and Jana. Thank you so much for your information. I'm Rosa Soto. I work here with Heather, and we are, just in complete shock, like everyone else, as to how quickly things are changing, and so the type of support that you are giving to better understanding for families is greatly appreciated. So I do want to say to our community that is on, take this opportunity to ask questions or maybe help us understand what more you want to know, so that we can continue the thread of response and finding answers, right, as those questions are coming up for you. So I just wanted to, again, thank you and Jana for coming on today.
You're very welcome. It's a pleasure.
Yes, thank you so much. If we have any immediate questions for Gina about the particular work that you're doing with the immigrant community, maybe we will take those right now, and then if you're available, we can stay for kind of that broader conversation as well. Any immediate questions? Okay, we'll let people digest some of what you're saying, because I do think that there is a lot more to be said here about just how this is impacting our community. But we do have multiple presenters, so why don't we continue the dialogue, the presentation, and then we can move on to our Q&A portion.
Yes, and Heather, the reason I came on, I forgot, is just to say for our presenters, if you can help us, a lot of the information that we're sharing is very technical. I want to be able to help our interpreters be able to, digest the information and be able to share it back. So if we can just do a little bit of a slowdown for the next presentation, we'd greatly appreciate it.
Thank you. Always a good word of advice. It is hard to keep up when you're doing the simultaneous interpretation. All right, with that, I'm delighted to invite our next set of presenters from the Office of Immigrant Affairs. Diana, would you like to kick off this portion of the presentation?
Hello, everyone. Good morning. So Haidy from our team is actually going to be presenting, and I will be sharing my screen.
Okay, fantastic. Thank you, Diana, and thank you, Haidy.
Can you see my screen?
Yes, I can see the screen just fine.
Perfect. And just waiting on Haidy to, I believe she's on.
Can you hear me okay?
We can hear
Yeah,
you.
there you are. Hi, Haidy.
Hi, Heather.
I
So we
think
can go ahead.
Sorry, one moment.
Perfect.
Still good?
Yes. I will be rather quick so we can give adequate time to Leticia and the rest of the presenters. My name is Haidy Juarez, and I'm here with the Los Angeles County Office of Immigrant Affairs. And I'll be rather quick. Gina and Jana went ahead and covered everything that I was going to talk about. But so what I'll do is I'll focus a little bit about the public agencies here at the local level. They did a phenomenal job. I could not do better. So I'll talk a little bit about some programs that the Office of Immigrant Affairs is administering. As Gina mentioned, many organizations and service providers are seeing funding cuts. We were definitely one of them that affected many of our immigrant community members here in the County of Los Angeles. But there are two programs that are still being funded here, specifically through our office, that we want to talk about for service providers that we want to ensure that you are aware of so you can plug some of your patients or clients too, depending on what their needs are. So Diana, we're going to go ahead and jump ahead a little bit. We're going to move past this as well. Our office, for folks, just as FYI, we were established just after the administration was established back in 2016. So in 2017, this was really a community-led effort. So this was done by many of you in the community, advocates and service providers that said we need representation at the county level for our immigrant communities here in Los Angeles County. And at that time, I just so happened to have been at the wellness center, and we were seeing many of the effects of that administration bombarding our communities back then. Now it's just so different and happening so fast. But the providers are also acting proactively, supporting our communities, and also together. I think that's also been a significant change that I've seen now, is that there is interdisciplinary efforts and that we're seeing here at our office. There's libraries, parks, healthcare providers, and providers in many different spaces that are really motivated in supporting our immigrant communities. And as the public counsel team talked about, know your rights and providing education and information to community members, that also is really important and relevant to service providers and advocates in different disciplines as well. So with that, we're going to jump to the next slide. So one question that we generally get is, who does the Office of Immigrant Affairs serves? I think for the most part in this space, folks have some idea, but we serve everyone within the County of Los Angeles, within the 88 cities of the county. So we'll jump to the next slide. We serve folks that are undocumented, as well as naturalized citizens. So just everyone under the sun. I think it is really important to also serve our community members here that might not identify as immigrants as well. It's really important to provide that just broad education and information to establish and maintain community for our naturalized citizens, our undocumented community members. This is sort of an overview of our office services. We are embedded within a larger county department. LA County has just nearly 40 county departments. One of them is the Department of Consumer and Business Affairs, and we offer other services there. But what I really want you to take away from this is that all the services are free for our immigrant community members, workers, tenants. So there's an array of services that are available for folks. We're going to jump to the next slide. Thank you, Diana. So I do want to briefly talk about this particular program. As the public counsel team mentioned, providers are seeing funding cuts. We saw major funding cut at the beginning of the year. We were receiving funds from the feds, and it is now gone. So now Many of our asylum seeker populations no longer have that particular support, so we had to identify additional resources and services for that population. Fortunately, we have an amazing network of service providers here in LA County, and all those folks were able to get connected to services at the sunset of that particular program. One of the programs that we recently launched here is the Mobile Immigration Program. So this particular program does serve immigrants that are experiencing homelessness. Back in 2023, Los Angeles County saw unannounced state-sponsored buses, and many folks did not have local ties. About 2/3 of folks did not necessarily stay in LA County, but the folks that did stay did not necessarily have local ties, and they were experiencing homelessness. With that, it was also really important to ensure that we supported not only our newcomer population here in LA County, but also our long-term residents that were experiencing homelessness. And that's really what led to the launch of this particular program. On the next slide, which Diana's going to jump to right now, you'll have some information on how to access that program. Folks can submit a self-referral to this program, or as a provider, you can also submit a referral for services. It is completely free of cost to folks. We want to make sure that if you are experiencing homelessness, or your client specifically, or at risk, then we get them connected to services. We know that there are so many barriers for folks as it is, and then on top of experiencing homelessness, that compounds their barriers to access to, for example, getting an ID, benefits. There's the challenge of housing, food security. There's so many issues there. So we're going to jump to the next one. I will briefly talk about our Represent LA program, because I definitely want to give Leticia time and the rest of the presenters today. Represent LA is a second iteration of a program, the LA Justice Fund program, that was a pilot program here in Los Angeles County before my time. And Represent LA currently has about 13 legal service providers that provide affirmative services and removal defense, similar to what public counsel talked about earlier in supporting folks that are either in detention or facing removal hearings potentially. But it also serves other folks that are in sort of neither buckets, but maybe are asylum seekers or are workers that potentially have faced workplace exploitation, or minors that are vulnerable. So that program is available to folks. On the next slide, I have my contact information. If you need someone who needs a consultation or services, then you can just reach out to me. There's so many more topics that I can talk about, including the Know Your Rights, which we're actually going to have Leticia focus on today, or public charge, or some other stuff. But for the sake of time, I'm going to end it there, and we're going to hand it off to Leticia. Thanks, Diana. And I do want to do a time check, Heather, because I want to be mindful of the next presenter after us. How much time do we have?
Yeah, thank you so much for checking in, Haidy. I appreciate that. Yes, let's continue forward. I think we're kind of at the we have about 10 to 15 more minutes for this segment, and then we'll have to be wrapping up by about 10:20.
Okay, perfect. Thank you, Heather.
Right, so Leticia will be joining us next, I understand. Yes?
Hello, good morning.
Leticia.
Can you hear me?
Yes, we can hear you good.
Okay, perfect. Well, good morning. My name is Leticia Sarasua, and I am part of CARECEN. I am the program coordinator for the Citizenship Education Program, and also an OLAP rep. So today we will be talking about a little bit of what CARECEN is, what we do, and the most recent updates in regards to immigration and also avoiding immigration fraud. So, CARECEN was established in 1983, and since then, CARECEN has focused on working with immigration in protecting immigrants, not only Central Americans, but also immigrants from all backgrounds. And CARECEN is the largest Central American immigrant rights organization in the country. It empowers Central Americans and all immigrants by defending human and civil rights, working for social and economic justice, as well as promoting cultural diversity. We envision Los Angeles becoming a place where Central Americans and all other communities live in peace and dignity. And we are located in Koreatown. Right now, our funding was also affected, but we continue to provide services, immigration services, including citizenship, I-90 renewals, DACA renewals, TPS, and much more. It is important to remember that this is a public space. Therefore, we do encourage people to generalize their questions. We are in a delicate situation, and we just want to be mindful of the confidentiality of their cases. So CARECEN is part of the LA Rapid Response Network. What this is that if you encounter an ICE situation, if you see ICE in your neighborhood, you can document it and report it. The best way to go about it is to note the time and the date of the sighting, to try to obtain precise locations, and note if the agents were in a van, car, or on foot. If possible, it's best to take pictures or videos. There is 2 phone numbers where people can call to report these sightings. And for the LA Rapid Response, you can call the phone number that it's in pink. And for the Inland Empire, it will be the one highlighted in yellow. And just a reminder to everyone, remember that you have rights no matter what your immigration status may be. You do have rights, and some of those rights include the Fifth Amendment and the Fourth Amendment. The Fifth Amendment is basically the right to remain silent, and you can say that you choose to remain silent. It includes the right to refuse to sign or provide any documents. And you do not have to show identity documents. It's best to not show false documents or lie. Anything shared with officials can later be used against you. And for the Fourth Amendment is the right against illegal search or seizure. If an agent asks if they can search you or your belongings, you can say no. ICE and law enforcement cannot enter your home or search your belongings without your permission. They almost never have a valid search warrant, so do not give them permission. The best thing to do is just remain silent, stay calm, and do not answer any questions about where you were born, your legal status, or how you enter the country. Also, a reminder that carrying foreign identification documents, such as passports, can be used against you. If you are arrested by police, you have the right to government-appointed lawyer, and you have the right to a local phone call. If you are detained by ICE, you have the right to consult with a lawyer, but government is not required to provide you one. And you have the right to contact your consulate. Now, most of our community members are now familiar with the red cards, but these red cards have been really helpful for individuals who are, being in a immigration situation where they have been detained by ICE or questioned by police. It is stressful situations, and it may be harder to remember the rights. So showing this card will just, help them assert their rights in different situations. So these red cards are in different languages. So you are able to find them by going to the link on the screen, or you can also call CARECEN and we can help you obtain them. Now, we will be going into the immigration law and policy updates. These policies may seem concerning, but they are not intended to cause fear. They may not apply to you directly, but you might know someone who could be affected. By sharing this information, we aim to help members of our community better understand their level of risk. And if you believe you may fall in one of the mentioned categories, we recommend for you to seek legal advice with an attorney.
Leticia,
Yes.
this is Haidy. I think for the sake of time, we might have to bypass this particular section, but we can give the deck. I think it's already been sent to Heather and team, so they can share with the attendees.
Yes. So, would you like for me to skip to, let me see. Yeah, so all the updates for the new policies are on the slide, so they are able to see that. Avoiding immigration fraud also has the information there. So I'm guessing.
Yeah, I think that's a topic we haven't really covered before, Leticia, if you want to briefly touch upon that. You know, once again, we really want to kind of advise people on how to protect themselves against, like, what is the correct information, what is the misinformation, I think what's changed recently, and then I think this is an excellent topic. Thank you so much for bringing it to us.
Yeah.
Thanks,
All right,
Leticia.
well, we can discuss about avoiding fraud, immigration fraud, and that is being seen with a lot of notarios. And the best way to go about it is to treat it as a medical checkup, right? So we tend to do medical checkups every year, every so often. This is the best advice for you to do the same with your immigration situation. And one of the things to check for is when was the last time you spoke to an immigration attorney, and have life circumstances change? Obtaining a FOIA record also is the best way to prepare for any immigration services that you're seeking, as you will be able to obtain all your record that immigration can see about you. Now, ways to change immigration status, there is plenty of them, but not everybody qualifies for specific ones. Now, if you have an immediate relative and is a lawful permanent resident or citizen, you might be able to obtain immigration relief. Also, if you are a youth that has experienced abuse, abandonment, or neglect, if you have been a victim of a crime and you have reported the incident and you've been collaborating with the police, you might qualify for a relief. And if you have been a victim of a crime, for instance, human trafficking or domestic violence, there is especially designated countries who also have relief. So therefore, we do advise for you to check in with an attorney before starting any process. I know for notaries, it sometimes is cheaper. You know, you are able to save some funding. However, notary are not allowed to complete immigration services here, as they are not attorneys. They might be licensed in other countries. However, in the US, they are not attorneys. Therefore, they are able to help you with the forms if they know how to fill it out. However, they will not be providing that legal representation when needed. Sometimes our community members don't even get a copy of their immigration services that they requested. And once they are seeking, for instance, citizenship, it is really hard for the new caseworker to state anything and everything that was included in the previous application. So there might be a couple of issues there, as we do not have all the information that was submitted to immigration, and we just want to be consistent with that information. Now, like I was saying, in many Latin American and European countries, a notario público has the equivalent of a law license and is qualified to advise and represent clients before the government. But in the US, they're only qualified to witness the signature of forms. You can check, the best way to check on this is to check the State Bar Association for a list of lawyers. Is it sounding too good to be true? In case contracts and updates. Also, application copies. It's really important for you to have some type of record of any immigration services or in forms that you have submitted to immigration. That way, you are able to include consistent information on your future immigration services forms. If you have been affected, this slide should have been in English, and I do apologize for that. But if you have been affected by a notario público service, you are able to report it, and you are able to report it by going into using this link that we have on the screen. You are able to report the incident, and that will help the community members to also be protected. I know it was really fast information. However, if you do have any questions, we do have our information here. You are able to call CARECEN. If you need a legal consultation appointment, you can also call CARECEN, and we can provide you with a legal consultation where we are able to identify if you qualify for any immigration relief or any particular service that you are seeking.
Thank you so much, Leticia.
Thank you.
Thank you, Leticia. So now we have just this wealth of information, this incredible set of resources that have been presented to us from Public Counsel, from the Office of Immigrant Affairs, and from CARECEN. So I do know that we have one question in the chat I'll raise to any one of our presenters that says, if arresting and deporting non-citizens without due process is illegal, then there's their legal standing to sue ICE, to sue immigration enforcement, or to sue the government.
That is a situation that is constantly happening as of now. And the best thing will be to seek legal advice with an attorney, as every case is different. Therefore, they might have to, they for sure have to dig into obtaining more information about that particular case.
So it sounds like your standing would have to be you personally are being impacted. It's not like the generalized community as a whole could sue. You have to, demonstrate that individual harm. Are there other questions for our immigration experts? Obviously, we've covered so much information. We know things are in a high degree of flux. So even today, we're not sure where we will land. But I think one thing that definitely I took away is that with the defunding of all of these services, it's going to be incredibly difficult to continue agencies like yours to provide the work that you do. And so the needs increasing and the resources are decreasing at the same time, which is causing that kind of tidal wave effect. So I think one of the things we really reflected on is fear, that the community, I'm sure, is experiencing a lot of fear. And so are there things that in particular you would advise people to do or to know to kind of help alleviate their fear and, again, be realistic about what's going on? Because I think those are the two things we can, hopefully offer out.
Yeah, definitely. Sorry, Gina. The best advice will be to have a plan. It's really important to have a plan with their family members, especially if they have children. A lot of times we do not prepare for situations like this, and we do not have any plan on who's going to be caring for our children if something happens to the parents or somebody in the household. So it is really important to have important documents saved. One thing that we like to advise is for them to scan all these important documents and email them to themselves, but also to a person of trust. Sometimes in situations like this, you do not have any time to gather these important documents. Therefore, having that scanned and for somebody else to have those records will be helpful in situations like this, but also having phone numbers. It's really important to memorize phone numbers. And also, another thing is to just remember that they have rights. So staying calm, being silent, and asking to seek immigration legal advice from an attorney will be the best thing to do.
Yeah, I think I just wanted to highlight that point. I thought that the information that Leticia went over around know your rights as well as notario fraud is really like the key to answering this question, because we are, when somebody comes into contact with ICE, we're not there. So they really need to be armed with the information, with the phrases that they can use, and to really be familiar with their rights. And it's pretty simple information. It's the right to remain silent, the right to not prejudice yourself by telling ICE where you're from or handing over a document that indicates where you're from, asking if you have been detained or arrested, and if you haven't, leaving the scene, documenting the interaction. All of these things are really the first line of defense against immigration enforcement, and it's working. It might seem kind of like in the beginning, I think when we were sort of forming our advocacy plan, I guess, I saw Know Your Rights as sort of, I don't know, like on the side or something that was kind of like softer than like the litigation and the policy and all this. But the way we're seeing it play out is that really Know Your Rights has taken front and center. And I remember reading an article pretty early on and laughing out loud because Tom Homan, the border czar, was really lamenting that it was hard to arrest the immigrants in Chicago because, God forbid, they knew their rights. And now what they're doing is actually accusing us advocates of harboring and trafficking immigrants by just advising them of what their constitutional rights are. So to me, that's like the single most important thing you can do is know what your rights are and exercise it in the moment, which I want to acknowledge is incredibly hard to do. I mean, even when a police officer pulls you over for a traffic violation, it's a terrifying experience, So to be confronted with federal agents is really, really scary. So remaining calm, like Leticia said, breathing, trying to retrieve the phrases and actually put your rights into practice is really the most important thing that you can do. In addition to, as she said, having a plan, especially if you have children, having a plan for who is going to assume their care if you're deported, as well as making sure that any legal service provider you're working with is legitimate and is licensed to practice law. Because notario fraud is really rampant in LA County. It's something that we have also worked on for many, many years. And people oftentimes lose their life savings and are put in a far more risky situation than they ever were by going to people who are not authorized to provide legal services.
Wow. Well, thank you. I think that's a wonderful note to end on. That is the advice we want people to walk away with, which is know your rights. We have Know Your Rights cards in English and Spanish at the Wellness Center if anyone needs them. Please, please, please have one of those in your wallet. Download it to your phone. Have it with you. Practice those statements so that they're in your head. And although this is scary times and these are things we don't want to confront, like you said, Leticia, it's super important to do so. Do not be caught by surprise. Do not let your power be taken from you by not being prepared and not knowing your rights. And again, then be very protective of the people that want to help you, but maybe aren't really going to do that, but are really out there to take advantage. All right, well, with that, I thank you all so much. Thank you, Haidy and Diana from the Office of Immigrant Affairs for helping coordinate this. Thank you, Gina and Jana and Leticia, for joining us today and sharing your expertise. We're excited to continue this conversation with our community, and we've discussed internally at the Wellness Center about hosting a workshop where we kind of help people build those plans, walk through, step by step of how to design a plan that can help them to protect themselves and their families in the case of something unfortunate happening. So thank you again so much, everyone. I really appreciate the conversation today, and we'll be sharing the materials out again with everyone on the presentation. Moving on to our last presenter of the day, we're super excited to invite our colleagues from the Restorative Care Village to join us. And with that, I'm excited to invite Margaret to come ahead and join us and share a screen and talk. Alex and Margaret are going to talk to us a little bit about the Restorative Care Village Phase 3, pardon me. I'm so sorry. I'm trying to remove spotlight from Leticia, and I'm having a hard time doing it, but now I think I got it. Okay, good.
Okay. Good morning, everybody. It's really a pleasure to be here with you virtually. We've come before you many times, and I think this is the time I'm perhaps most excited to present because we're closer than we ever have been. The lovely thing about doing a presentation on local hire is it means the project is actually happening. How lovely is that? So I'm very, very happy to introduce Margaret White. If we go to the next slide, I'll give you a little bit of a reminder about the project, and then we'll jump into the fun stuff. So my name is Alex Damas. I work for Century Housing. We are the nonprofit that has been tasked with building out this lovely Phase 3 of the Restorative Care Village campus. Our portion of the Restorative Care Village campus is the affordable and permanent supportive housing, in addition to workforce and pure respite spaces. As a reminder of the building program, the building is being developed in 2 phases. The building in the back is Phase 1. That's the project that's happening soon. We expect to start construction on that project in July, late June, early July. So really coming up very fast. It's fun. The building in front is Phase 2. We need to apply for one final source of funding. Those are state tax credits. Assuming that we're successful in our application that goes in at the end of this month, we would intend to start Phase 2 in January or thereabouts. So really coming up quickly. It's very exciting. The buildings themselves, it's almost 300 units between the 2 buildings. Half of those units generally are for those who are experiencing homelessness or have formerly. The project includes 115 parking spaces, a 12-bed pure respite center, workforce spaces, opportunities for community art, transportation improvements, and improvements of the streets on Griffin and Eastlake. And with that, we can again get into the fun items today. So Margaret, I will turn it over to you.
Thank you, Alex. Hi, everyone. It's a pleasure to meet you and share the space with you. Before I get started, I just want to really thank everyone that did the presentations on the immigration rights. We've been doing workshops at our job sites for Know Your Rights. So that's been a huge help to the construction workers and also to the supervisory staff on the job sites. And we've been utilizing a lot of the resources that you shared today. So I just wanted to thank you all for that important work. So again, my name is Margaret. I am the founder of Power to Workers. We are a jobs coordinator that helps with the jobs, and we'll be helping with the Restorative Care Village Phase 1. So today I'm just going to go through with you a little bit about the service that we provide, the requirements on the project, how you can help us with outreach, and how we can hopefully help you as well to get people to work and support them in construction career pathways. So Power to Workers, we are a nonprofit 501c3. We were a part of the HICP through the Third and Dangler project, for those of you that might remember. We also worked on the Bryan Residential Project, which is nearby. So we do have a lot of resources available in the area and partnerships and workers that are available to work, which is great. Our mission is to empower local residents by connecting them with rewarding job placements on affordable housing projects, which not only strengthens neighborhoods, but also helps to reduce unemployment and foster economic growth. So for the Restorative Care Village Phase 1 project, we have a 50% goal, that 50% of all work hours shall be worked by local residents residing within the Tier 1 area. If the 50% are not available within the Tier 1, we'll go to Tier 2. And the next slide, I do have the Tier 1 zip codes, and hopefully we can share those out after this call. So the next goal on the project is that 10% of the total work hours will be worked by targeted workers who are also local residents. And so we'll go over the list of what qualifies somebody as targeted. Our team will be on site weekly to do those targeted worker interviews. And also as we interact with the community and get people prepared for these jobs, we do track whether they qualify as targeted, so that as we're advocating for them to receive these jobs, we can ensure the contractors that they'll meet the goals. So this is the Tier 1 area. These are the zip codes. So, as we ask to partner with you and activate you to help us with our work, we'll be sharing these zip codes so that you can focus on those with your outreach. So what is a targeted worker? So this is LA County's list. So first, those that have a documented annual income at or below 100% of the federal poverty level, no high school diploma or GED, history of involvement with the criminal justice system. That's a question that we get a lot in our work, is whether somebody with a background can qualify for the jobs. And I say it's actually a qualifier, not a deterrent. So that's often good news for a lot of our partners that do deal with restorative justice. Those that are experiencing homelessness, custodial single parents, former foster youth, veterans, English language learners. So this is the list. And again, we'll hopefully, Heather, we can share these slides with the group after we're done here. Thank you. So this is our referral intake flowchart. So the idea is that we do outreach. So spaces like this, we go to job fairs, farmers markets, just really any event that we can share space. And we are in contact with somebody who's interested in working on the project. The qualification that we give the employers is that anyone that we refer will either have construction experience or they have completed training and know how to be safe on a job site. So anytime that we table or engage with our partners, we make sure that we have training opportunities available, because that is the key for a lot of people to be able to get into construction. So if they're interested, we're going to check and see if they have training. And if they don't, we're going to refer them to a training partner. We're focused on this project with the CAUSA Youth Build, East LA Occupational Center, also CRCD's MC3 program is a partner that we work with often. And we're open to being introduced to any other training partners that you may be familiar with that do the OSHA training. We save their resume and we invite them to our information session where they complete our orientation. We ensure that they meet the local zip code requirements, meet the targeted worker requirements, and also check to see if they have any barriers to employment so we can help them eliminate those barriers. Big ones are transportation, housing, childcare. So we talk about all those things in the orientation on a one-on-one basis with every participant. From there, we are referring the candidates to subcontractors. So our work is based in compliance. As you can see, we've got a compliance department. So we're really able to do our work through labor compliance, tracking the hours on the project, and working with the contractors to get in compliance with the local and targeted goals. This is a typical hiring pipeline. So this is around how many projects we expect to create on any given project. So 38 estimated commitments. And as you can see, and as you probably know, if you see a construction project happening near you, not all the jobs come at once, right? You've got the earthwork, you got the concrete, you've got the framing, and then so on and so forth. So this gives an idea of the phasing schedule as the positions come in. And our call to action to you. So first, if you're a community-oriented group, and I imagine a lot of you are, to refer your participants to us, share any tabling opportunities with us. So again, job fairs, farmers markets, any community events. sharing our flyers on social media and in your spaces. We can bring flyers to you. So just let us know if you have a physical space that we can share flyers. Attending our job fairs as a community-based organization to share your resources with the participants. A big one is expungement clinics. Anyone who's dealing, even with the immigration rights. I don't know if you guys have tabling, if you're doing tabling, but we would love to have you out if so. And mutual support. Let us know how we can show up for you. Our work is just rooted in trust, and we understand how important it is to trust people that you're referring your participants to. So we just want to really work to build that relationship with you. And how could your participants best engage with Power to Workers? So how do we work collectively to prepare people for construction career pathways? So like in the event of a work source center, we're going to work with them to make sure their participants have updated resumes. If they come to a job fair dressed to impress, making sure that they have their resumes at the job fair. That's a huge thing. It's like when people show up at job fairs without resumes, it's like, this is a big tool that you need. So that's an important one. Staying connected to the construction industry by registering with us, helping people build their soft skills and confidence, being able to speak with confidence about themselves and their work, and especially their training. This is a group that graduated from the CRCD training that we hope to support to get working on another LA County project. To date, we've put 93 people into construction career pathways, and we've got a lot more that we've supported to get into construction just outside of a job with us. So it's been a great impact. We ask for you to follow us on IG so you can, again, just share the flyers and information, and we can do the same for you. And this is our contact info. I see that there's a question from Monica. And thank you for your time, everybody.
Hi. So my question is, I wonder, do you have a program that could reach out to high schools because one of the local high schools has a construction program or a construction class, and I'm wondering if we could build a program to help those students uh, um, get into these type of jobs when they're already in that path and start a program with that high school.
Yeah, that would be amazing. We'd love to learn more about it. If you can perhaps send me an email with those details, we can connect with the school, connect with you and the school, and just figure out a best way to do outreach with the students, especially graduating seniors, and just, make sure that the program's aligned and see if there's anything we can do to suggest, improvements, or if they're doing OSHA training or they're not, it would be good for them to do that. There's a high school in Ventura County in Camarillo called ACE High School, and we network with them on the projects up there doing just outreach with their seniors. And that's a great way to connect. Employers love to try to help the youth to get into construction. So
yeah, so I'll send an email to everybody on this on the slide, and just to connect, because I didn't even know that the high school had this program, but it's a 2-year program, and they learn the basics, and I talked to the teacher because of the work that we're doing here, and I was like, I want to connect them, so I wanted to take this opportunity to do that. So I'm gonna go ahead and just see how we can connect and set up a meeting with the teacher and stuff like that.
Thank you, Monica. That sounds amazing. May I ask the name of this school?
Franklin High School.
Oh, okay, got it. Thank you. That's great to hear.
Thank you.
Thank you. Hi, Guadalupe. Did you have a question?
Yes, thanks, Margaret, for the presentation. I was wondering, I think you have an event is it next month, May 9th?
It is. It's Friday, May 9th.
And and then is there going to be any other opportunities beyond that? Given that it's coming up very soon, I'm sure there's going to be others that will be interested. And then will there be translation? Do you work with folks that maybe are monolingual as well, speakers? Just
Yes,
curious.
we've already planned for for translation during that meeting. So we have Libby and many people on our team that are first language Spanish speakers. So they'll be supporting me with that presentation on the 9th. And we'll continue to do those. Our hope is that we can do that presentation, record it, start to really promote it on social media, and just continue to engage with community partners to attend those. We're also going to be planning a job fair. I don't know if you guys know that LA County now requires job fairs on every project, which is great news. So we'll be doing 2 for this project, one early and then one as the construction continues. So we'll make sure to build that roster of contacts and outreach partners and just continue to engage everybody.
That's great. Do you have the promo material also in Spanish? I think I
Yeah.
only saw it in English. I wasn't sure.
Yes, for this one, we will have the translation ready for the night.
But I mean, do you have the flyer in Spanish as well that we could also circulate?
Yes, I will make sure that we get that out. Thank you for that reminder, Guadalupe.
No, no, I think that would be helpful. And then I know there's also going to be some there's given what the RCV, the 2 projects that are going on the campus right now. There's also going to be, construction jobs through that, and wondering whether there's any collaborations that could be done, even after May 9th, given that those projects and yours, they're in the same area. So just is there room for collaboration?
Absolutely. Do you know Guadalupe who's doing the jobs at that project? Or can
Well,
you maybe send me an email on it so we can connect with them? That would be great.
yes, so I'll connect you. And I know Alicia from Public Works. She's
Mhm.
always been very helpful with, working on that with our DEO. And so the contractors, right? They have certain folks assigned. And I'll connect you via email with, I think I have an email with you and Alicia and Isidro from our DEO.
Perfect.
So
Okay,
those would be the folks, but maybe we can do something, you know?
yeah, no, that would be great because I mean, a lot of the time when we're getting people working, sometimes as they're getting into the construction trades, work can be a little sporadic. So the more that we can work together to create a roster of common people that live in the area, have completed training, I mean, we're happy to share those resources with the partners because the ultimate goal is to get people working. And the more that we can support as positions come up, like if somebody is trained for cabinets and then we have our cabinets position and then they go, over to another project, that kind of synergy can be really helpful. I work at the Jordan Downs and we do that with Walton, where we kind of compare notes on, who's working where and just trying to maximize the jobs. So we love
Yes.
collaboration.
Now, what is the timetable? I believe it's June, right? That when you're looking to break ground for the project. So you're looking to identify folks, you know, right up to that point, right? I suppose.
Right, right. So the first phase is the earthwork phase. So usually that's grading, wet utilities, and sometimes shoring, which is a pretty specialty trade. So and I don't know, Alex, how in detail you are on the schedule, but I assume earthwork's usually about 3 or 4 months of just in the dirt, right?
Yeah, I think we'll probably spend between 3 and 4 with concrete coming for several months thereafter.
So, and that's when things will really get busy once the concrete starts. So we'll have a few positions on that early phase because mostly it's people driving tractors, installing the pipes under the ground for those first couple of phases. So we usually get, a couple of positions there. And then when concrete starts up, it's when things really ramp up.
I was going to ask you, do
Yeah.
you work with groups also like Winter that are training like women in non-traditional
Yeah.
um, jobs? That's also a partner in the community, right? That I think it'll be good to connect with.
Oh yeah, we work really closely with Winter. We have a lot of graduates from their program that we've gotten employed, so we do work closely with them. Thank
Great.
you.
Thank you.
Yeah, and I'll say, for anyone who's listening here, we've worked with Maggie or Margaret for quite a while, and I've always been impressed that the only thing you really need to show up with is a willingness. They'll help you with everything else.
Yeah, and the great news is we've started to get grants to support our work. So we've been able to help people with vehicle repairs, tools, union dues, and that really has helped us amplify our work and, just spread the word that not only do we have the opportunities, but we can support people to be successful. So it's been great. And thanks, Leandro, for the shout out.
Thanks, everybody.
Yeah,
Appreciate it.
I was
Thank you
going to
very much,
say,
Margaret.
and that same statement echoed in the chat from Leandro from Prime Store. So obviously we have some trusted partners here, and we love when you build depth of relationship in the community. You really get to know our community. You build the relationships with incredible partners like Monica, and then that really helps elevate, brings so much additional benefit back to this community. So do we have any additional questions or comments for our fabulous presenters from the Restorative Care Village 3 Century Project? All right, if not, I truly believe we will have you back again. This is far from the last time we'll be hearing from you, I'm sure. But we'll thank you, Alex and Margaret, for joining us today. And I think we're going to round out our meeting time with a quick announcement from our fabulous partners at Centennial on the next project. So my apologies. I keep getting to this place where I can remove the spotlight from one person, but then I can't find out how to remove it from the second person. So give me one quick second. I'll get there, and then we'll Leandro, are you going to do the announcement for us today about the upcoming community meeting?
Yeah, absolutely. Can you hear me okay?
We can. Thank you. Take it away.
Wonderful. Just a quick announcement to the community that we are hosting a wonderful community event coming up on May 7th at 2323 Workman, which is the Lincoln Heights Senior Center. We're going to talk about updates related to the rehabilitation of the historic General Hospital, as well as the revitalization of the West Campus. We will be serving food. We will be having some fun. So please come, bring your neighbors, bring yourselves, and bring your energy to talk about ongoing information and collaboration for the Centennial Partners and Prime Store Project. Thank you. Thanks, HICP.
Thanks so much, Leandro. So again, we're so excited to have these fantastic partners, developers, and the adjacent agencies that are working together collectively on our campus. And again, if you please help us get the word out about the Centennial Community Meeting that is happening this coming Wednesday. We want as many community members to come out as possible to just kind of really get to know the project team and continue the dialogue and conversation about the project itself and the benefits that are underway and in development. All right, and thank you, Claudia, for the reminder that the flyers we posted into the chat. There's a link on the flyer to register. So again, if you could take that flyer, distribute it out to your network, we would really appreciate that. With that, we are at time, a little past time. Thank you one and all for joining us today for May's HICP. A wealth of information. My compliments to everyone who was able to stick it out with us this entire time. And we look forward to seeing you on Friday, June 6th. We will be back to a hybrid model at that time. So please join us both at the medical center or via Zoom as your schedule permits. And with that, go and have a wonderful, wonderful month of May. Thank you one and all.